Good evening, and welcome to my How Healthy Are You weekly educational podcast. My name is Dr. Thomas Brewer. I'm a PhD chemist, and for this week's podcast, I have two topics. One is blood pressure, and the other is gout. Now, the last time I focused on blood pressure as a topic was about exactly 1 year ago. I think it was December 19th of 2019. Boy, what a year it's been. Anyway, for this podcast, I'm going to go into a little more detail, and this is going to be very complete. So if you have blood pressure, this would be something to refer back to. If you know of somebody with high blood pressure, this would be something to refer them to. So there are essentially three main reasons our blood pressure goes up. Only three. One of them is due to some sort of buildup in the arteries. So this is typically plaque. Western medical doctors call it calcification because one of the components in plaque is calcium. This is calcium not from plants, but this is calcium from supplements that is mineral-based. So these are the calcium carbonate supplements. Check your calcium supplement and make sure it's not made from calcium carbonate. The same is true with magnesium supplements being from magnesium carbonate. So this buildup of plaque that is a mixture of LDL cholesterol, the bad cholesterol, fats, oils, sugars, bacteria, even your own blood platelets, they all mix together and harden and form plaque. Similar to the plaque that forms on our teeth, the fact is it's a mixture that hardens. It's not one single component. So this plaque on the artery walls causes two problems. The first problem is it can close off the artery. So essentially the artery gets narrower and narrower. And as we all know, if we're trying to push water through a hose nozzle, if I want the water to shoot really far, I want a real small opening on the end of my water hose. And what that does is it increases the pressure. So if I'm trying to get the same volume through a smaller opening, the only way to keep the flow rate constant is to increase the pressure. So that's what happens in our arteries. The body wants a certain amount of blood. If the arterial wall is narrowed because there's plaque buildup on the walls, well, the only way to keep the blood flowing with the same volume is to increase the pressure. It's the only way to do it. So the blood pressure goes up. The second reason plaque buildup is a problem is the arterial wall gets hard. It's analogous to a steel pipe versus a rubber tube. We want the blood vessels to expand and contract a little bit as blood is pumped through our artery. So every time the heart beats both out and relaxes, we want the blood vessels to be very flexible or malleable. The two terms for this are arteriosclerosis and atherosclerosis, but they are used interchangeably, and medical doctors will use arteriosclerosis to mean plaque buildup, but sometimes they'll use arteriosclerosis to mean hardened arteries. And then the opposite's true with atherosclerosis. They'll do the same thing. They'll use the same word to mean both. In either case, there's plaque building up on the arteries. And so usually both happen. The artery gets smaller and harder to, it's less flexible. If a piece of this plaque breaks off, that's what causes a stroke in the very small capillaries of the brain. So this is a bad thing. The way to stop this form of increase in blood pressure is fairly simple. There's two things you're going to want to do. You're going to want to take your plant enzymes at bedtime, and what they will do is they will break down the plaque in your arteries while you sleep. Normally you would take plant enzymes with a meal so that you can digest the meal. So these enzymes increase the rate of digestion like any catalyst. But when taken at bedtime, since there's no food present, then they'll work on your arteries, they'll clean up your blood, and they'll clean up your arteries. Now, the other thing to do, not only taking plant enzymes at bedtime, but you'll want to slow down or eliminate the formation of the plaque in the first place. Taking plant enzymes at bedtime is great if you have plaque, but you'd also want to stop forming it. And that's where the heart algae comes in. I talked about heart algae when I was talking about the blood-brain barrier a few weeks ago, and the active ingredient is astaxanthin. But it's a very good antioxidant. It's a better antioxidant than cholesterol. And by the way, that's why cholesterol hardens. It's acting as an antioxidant, and we don't want it to have to do that. So if you give your body a stronger antioxidant than the cholesterol, then the cholesterol doesn't need to harden. Now, it goes without saying you want to improve your diet. So the more vegetables you eat or plant-based foods you eat, the less plaque that's going to form. So that's for the buildup of plaque. Now, if you just want to focus on hardened arteries, so if you believe your blood pressure is because your arteries are more like a steel pipe than a rubber hose, what you're going to want to do is consume foods that are high in nitrates. These would be vegetables high in nitrates. The best one is beets. So you would typically eat them raw, throw them in a blender. If you need a recipe, I can provide that. Just give me an email or a text message or phone call. But you would typically put the beets in a blender with a few other vegetables. You would only need about half a beet a day. And when you're putting beets in a blender, don't forget to put in an equal amount of the green stem. So if you use half a beet, you would want to use half of that green stem. Now, if you don't like beets, or if there's no way you're going to have half a beet a day, on your off days, I suggest the Neo 40. This is a product I have in the office, and you can call me and order it. You don't have to pick it up at the office, but we do have free shipping. And it's called Neo 40. It's absolutely the best nitric oxide producer. So you would eat beets or take Neo 40 so that you make nitric oxide. Nitric oxide is a gas. It's one nitrogen atom, one oxygen atom. It looks like NO, the word no. At least the chemical formula is NO. And what it does, this gas relaxes the arterial wall. And most people, regardless whether they have plaque or not, they'll see a reduction in their blood pressure. In fact, just about everyone will see a reduction in their high blood pressure just by taking Neo 40. Athletes take it to increase the blood flow through their arteries and veins, especially while exercising. So it's a very, very good product. Okay, so that's one of the three causes of high blood pressure, the plaque buildup. The second cause is simple kidney blockage. So our kidneys act as a filter for all the blood flowing through our body. So if the filter is clogged in the least bit, how do you get the flow of fluid through the filter? The only thing you can do is increase the pressure. You need to push harder to get the same amount of blood through the clogged filter, in this case, the kidneys. Well, that's high blood pressure. That's the definition of high blood pressure. So when that's occurring, all you would need to do is, again, take your enzymes. If you take your enzymes with your meals and also at bedtime, it will, or at least they will, dissolve these spicules. They're typically a combination of proteins and urea that have hardened. So if you dissolve them, the blood pressure goes back to normal, as long as that's the cause of your high blood pressure. So if the cause of your high blood pressure is blockage in the kidneys, which is fairly common, it's the second most common cause of high blood pressure, the first being the plaque buildup. Again, just take enzymes. There's not much else you can do. On a natural side, I recommend very, very pure water. Also, celery is good to consume essentially on a daily basis, whether you eat it or juice it. As you all know, I'm very big. I'm a proponent of juicing celery in the morning. But even eating the celery is great for lowering blood pressure. And of course, taking the enzymes will dissolve these fibrins in the kidney. All right, now the third cause of high blood pressure is due to the blood having too much density, meaning it being too heavy, too thick. And what the problem is water. If there's too much water in the blood plasma, it's actually harder to pump. It takes more pressure, more energy to pump the blood. And the way our blood gets too much water in it is when we consume salt. The ratio is pretty intense. It's pretty surprising. For every unit of salt, your body needs to surround it with 6 units of water. So you have this 6-to-1 ratio of utilizing water and surrounding the salt, and this gets released into the blood, and it makes the blood harder to pump. Eventually, you'll urinate out the water and the salt, but then you eat again, and the cycle starts back over. Most people don't know how much salt they're consuming. If you're only consuming foods that you're purchasing in the produce aisle and cooking, and you're not adding salt, well, then you're not consuming excess salt. But pretty much any food bought in a store that is packaged has salt in it. And all you have to do is read the label under nutrition for sodium, but also under ingredients. It is shocking how much salt is in our foods. It does improve flavor, and that's why it's added. But store-bought foods typically always have salt, and people think salt is not the cause of their high blood pressure. Often it is the cause because it's sneaking into the foods they didn't even think had salt. And all we have to do is start reading our labels, which I've been advocating for years. Read the labels and learn how to read the labels. And these are always good topics to go over on future podcasts. But a lot of our favorite foods have salt in them. So there you have it. Causes of high blood pressure, plaque buildup, kidney filter blockage, and salt intake. So that is the first question. Now, the second question is about gout, and I thought I had covered this in a previous podcast, and I looked at the index and realized I don't think I did. So I'm going to talk about gout. Speaking of index, in the newsletter, I'll be posting an index for all of 2020, all of the newsletter and podcast topics. So all of the podcasts will be on YouTube. They're also on Facebook. All of the newsletters are on Facebook. If you don't have access to Facebook or YouTube, then send me an email or leave me a message and tell me what number podcast or newsletter you would like. So they're all numbered in the index. So if you provide the number or the title, I'll be able to send it to you and just email it to you again. So as far as gout is one of those diseases, kind of like diabetes. You don't know you have it until a doctor tells you, or you have some sort of pain or some sort of episode. I mean, you'd even think that heart disease is something like that, or even high blood pressure. Often you don't know it until something happens. With gout, it's typically the pain, the sharp pain in the feet or the ankles. Gout is caused from uric acid crystals. This is something I see under the microscope during a blood microscopy. It's very common, and a lot of people are very appreciative that I can identify the gout crystals way before a person has pain. I'd like to say the same is true even with plaque. I can see plaque in your blood way before you have arteriosclerosis or atherosclerosis or any sort of heart-related episode, typically 10 or 20 years beforehand. So the plaque takes a while to build up. The same with the uric acid crystals. If I see uric acid crystals in your blood, you may not have been diagnosed with gout, but you have the crystals. Same is true with the plaque. You may not be diagnosed with heart disease, but it's coming. So a big advantage for looking at your blood under a microscope and seeing it with your own eyes. Now, the way to get rid of these gout crystals and also to prevent them from forming is somewhat similar to the plaque, but there are a few differences. These uric acid crystals form when there's incomplete protein digestion and too much acidity. So you need both to occur. To ensure complete protein digestion, then we'll go back to the plant enzymes. People with gout must take plant enzymes with their meals. There's just no question. But the second thing they need to do is they need to increase their intake of dietary calcium. And the best way to get plant-based dietary calcium is with the green leafy vegetables or other green vegetables, cooked asparagus, broccoli, but leafy greens of all types are good. You're going to want to consume these once or twice a day. If you can't do that, well, then now we move on to supplementation. The best is the coral calcium. It's called Coral Life. That's the best way to get plant-based calcium in the body that's not going to form plaque. Like I mentioned earlier, you don't want to supplement with calcium carbonate. But if a person has gout, or if you know someone with gout, tell them they're going to need to take plant enzymes with their meals to stop the formation of the gout uric acid crystals, and also to consume a lot of plant-based calcium. Now, if there's too many uric acid crystals, the same way we dissolve the plaque crystals is how we're going to dissolve the uric acid crystals, enzymes at bedtime, enzymes without food. So that's an additional way to take enzymes. Now, a lot of enzymes will not work without food. The enriching gifts enzymes work great with or without food, meaning they work in both an alkaline or an acidic environment. That's the way to both prevent gout and to get rid of it. It's all about the uric acid crystals. You don't want them to form, so you take enzymes and consume a lot of plant-based calcium. And to get rid of it, you're going to take enzymes at bedtime to dissolve these crystals. It's very easy to track these crystals, and if I don't see them during a blood microscopy, then you don't have them, and you're not going to have gout. So that's all I have for this week's podcast. Thanks for listening, and please don't keep me a secret.